Hey, this is Dr. Eric Lewis, and I want to thank you for your time and your trust. And I made this short video to give you a real good explanation of chiropractic and how it can help you and how it can make your life better. So I want you to know that there's brilliance in simplicity. I think Albert Einstein said that there was brilliance in simplicity. And this video is going to be short, sweet, and to the point, and it's going to give you a really good understanding of how chiropractic can help you. So the first thing, if you're going to know about chiropractic, the first thing you need to know is that a bone out of place pinches or irritates the nerves and causes problems in the body. If you can understand that, then you know chiropractic. So in other words, the problems that people have are caused from irritated nerves from bones being out of place in the body. Let me go ahead and show you what this looks like. If you take a look at this picture here, the left is a normal spinal model from the side view, and you can see there's the vertebra, there's the nerves, and there's the discs. If you look at the one to the right, the second vertebra from the top is pushed back, and that's a condition in chiropractic known as subluxation. That's really the only term you need to know if you want to understand chiropractic, is subluxation. And what that means is misaligned vertebra. But the thing about it is subluxation puts pressure on the nerves, pressure on the discs, and you can see that compression there on the disc, and causes problems in the body. Now the best thing for this is to give it a nudge and put it back into place to take pressure off the nerves so that the nerves work better and therefore the body functions better. Now here's what I need you to understand about subluxation, is that you can't feel subluxation. What you feel are the effects of subluxation. It's kind of like a cavity. You don't feel a cavity until it hits what? You feel a cavity when it hits the nerves. So the same thing is true with subluxation. You don't feel that. You only feel it when it hits the nerve. But a lot of times subluxations can be present without you even knowing it. So let's go ahead and take a look at that again. The second vertebra from the top is what a subluxation looks like. And in a few minutes, I'm going to show you exactly what this looks like on x-ray. So let's go ahead and take a look at a normal low back x-ray. This is a normal low back x-ray. And if you can see these little boxes, which is the vertebra, all these little boxes stack on top of one another, and they all work as a team. And when they do, there's no problem. Now, the hips are level and the spine is straight. If you can see this, then you're an expert in spinal alignment and you can understand exactly what the ideal spine looks like. Now, from the side view, you're supposed to have flowing curves. So from the front, it's supposed to be straight, and from the side, there's supposed to be curves. I'm going to show you a little drawing here, a little chart, if you will. In this chart, you can see how there's curves from the side. Now, each area, there's 24 bones in your neck and your back. There's 24 bones in your spine. And in between each one of those bones, there's little nerves that come out all the way down the spine. And you can see that there's possible effects or conditions from that. Now, if I zoom in here, let's see if I can zoom in. You can see that pretty much there's many things that can be caused from compression of these nerves. And once again, our job in chiropractic is to line these bones up to help the body function better. So let's go ahead and take a look at this. This is an x-ray of a subluxated spine. If you can see how this is deviated to the left, you're looking at this person from behind, and their spine is deviated to the left. There's multiple subluxations and there's multiple effects in this person's body. My job is to line this up to give it the best opportunity to heal so that the body functions better. It's as simple as that. Whether you have pain or whether you don't, my job's the same, is to analyze the spine, check the posture, and line you up. So let's take a look at this. This is the same person before and after. And you can see how the one on the left is the spine before, and then the one on the right is the spine after chiropractic. Now this took about a month to correct, but it didn't take 2 years like braces on your teeth. It took about a month to correct. With certain stretches and the right chiropractic adjustments, we can line the spine up. This is a patient in my office, and I wanted to show you that we do make corrections and it is possible. So now you're an expert in chiropractic. You understand what it is. I wish you the best of luck, and I'll talk to you soon.